of the care that you need and what that means for your future. Yes, we have a lot of work to do to improve health reform, just as we did with Social Security, but I have to agree with economist Paul Krugman that health reform is a tremendous act of human decency, giving our nation the possibility of at last being on the road to providing universal health care. So now, about health reform and what it does and what it will do. So if you're going to the elections and you're trying to figure out on health care which candidate to vote for, one of the things to look for is, do they plan to support and uphold and improve health reform, or are they pledging to oppose it and repeal it? And to know why that's important, you have to understand what health reform is and does. And just real quick, I wanted to call attention to, we have some materials out at the table over there, but we have this green handout that lays out, I think very nicely, what the health reform law does and what it will do in 2014 if it continues. So one thing to know about the health reform law, just starting out, is that it does require that members of Congress get their health coverage from the same plans as millions of Americans. When health reform is fully implemented in 2014, Congress, for the first time, is going to have to shop for the same kind of health insurance that you and I will. Okay, so this is a big victory for many healthcare advocates. Some of the changes and improvements under health reform have actually already been implemented over the last couple years, while the rest will take place in 2014. It's been sort of this, this process of rolling out this massive new health reform program. So the big changes and improvements that happened early on were for people who had insurance already. Or were getting insurance. And these came in the form of protections and benefits for children and young adults and new regulations for health insurance. In terms of protections and benefits for children and young adults, there are two major new benefits. One is the protection from denial of coverage, and two is the expansion of coverage. And a lot of people have heard about this, but insurance companies can no longer deny children up to age 19 coverage because of a pre-existing condition. This is very important, as you can imagine, because prior to this, insurance companies were looking at birth weight and determining that that could be a pre-existing condition. If a baby was born and was sort of bigger than the norm or smaller than the norm in terms of their weight, that could then be used as a pre-existing condition to deny coverage for other health issues. And sometimes children are born with congenital problems. Those would be pre-existing conditions. Insurance companies can no longer deny coverage based on that, so there's lots of grateful parents out there. They have to cover children's regular wellness visits, immunizations, flu vaccines, and things like that. There's a lot of that in the new health reform law, you know, to try to improve people's health and help people maintain their health and emphasize early detection and screening. One of the big things is that young adults may stay on their parents' insurance until age 26 if their employer does not provide them with health insurance. This has led to millions of young adults getting insurance when they were previously uninsured. It doesn't matter if the young adult is a college student or not. It doesn't matter if they're married or not. All that matters is whether they have an option to get health insurance from their employer or not. And if their parent has health insurance, they can get onto their parent's health insurance plan. This is really a big deal. I don't know if y'all remember, but prior to this, there used to be a lot of maybe it's just me and my coworkers who are in this little wonky world of healthcare, but there used to be a lot of talk about the young invincibles. The young invincibles are, you know, these young people in their 20s who, and I think the insurance industry manufactured this term, but who called the young uninsured people young invincibles. And the assumption was the reason they didn't have insurance is because they had this arrogant, you know, youthful attitude that nothing would ever happen to them, no harm would come to them, and therefore they didn't need health insurance and were choosing not to get health insurance. The reality is that most young people do want health insurance. They want that protection, they want those benefits, but most of them work jobs, and more the case now, that don't offer health insurance or the option of purchasing health insurance. So this provision of health reform has changed that, and that has made a big difference. Now the regulations. The regulations that have been part of health reform are things that healthcare consumers has fought for years and years and years. And finally, it took a national law of over 2,000 pages to make the insurance industry operate somewhat ethically in terms of the products that they are putting out in the market. Until these regulations came into place, a lot of times people experience health insurance as a nice, costly umbrella that would melt in the rain. It would fall apart when you needed it most because insurance companies were able to rescind or drop your care if you got sick. If in the last year or last couple years you had a major illness or got diagnosed with a major health problem like cancer and your insurance company didn't drop you, especially if you had a plan from the individual market, you can thank health reform for that. It is now against the law for insurance companies to do that. And we used to have clients at the Healthcare Consumers who were experiencing exactly that. And then good luck getting them health insurance when they are dropped and in need of chemotherapy to deal with their cancer. Those days are gone unless health reform gets repealed. Insurance companies can no longer place lifetime limits on the coverage they provide. This is a huge victory because nobody from a consumer perspective can control the cost of health care. So we've worked with a lot of parents who have young children who were maybe born with a congenital problem or had cancer and needed very costly treatments and who could amass over $1 million of health care costs in 3 or 4 or 6 months. And in the past, if that was a lifetime cap on that policy, that child would be out of coverage. They can't do that anymore for adults as well as for children. So that is very good. And now also health insurance companies are responsible for paying 80 to 85% of their premiums for health care services provided, and if they don't, you get a refund. And some people have actually gotten refunds. There's a lot of benefits to women. I won't go through all of those, but just some big ones are that a lot of the out-of-pocket expenses related to routine care and even co-pays at the pharmacy for prescription contraception, those are now waived. They're part of the benefit. So women, it's a way of addressing sort of that discriminatory pricing in health care where women